You may have heard about the exciting idea of recovery in mental health practice, but still be unclear what it entails. I'm Dr. Richard Hoefer from the University of Texas at Arlington's School of Social Work. With strong support from the Hogg Foundation for Mental Health, I'm presenting information to help you learn more about the recovery to practice movement and what the concepts of recovery are. The purpose of this training is to advance the goal of the Hogg Foundation Recovery to Practice grant program. We seek to enhance the implementation of recovery-oriented practice among behavioral health practitioners through participation in comprehensive discipline-specific training, including for social workers. For many years, individuals who identified as having a mental illness were merely treated with no hope of a better life. Their basic needs may have been met: food, housing, sometimes medication, but with no goal of improvement or recovery. However, there has been a shift away from a medical model of treatment to recovery-oriented care, which focuses on instilling hope, connecting people to peer support, using self-directed symptom management, and other recovery principles. This information will be helpful to anyone interested in learning about the recovery to practice approach to improving mental health services, whether they are still students or are experienced practitioners. In this video, you'll learn the differences between the concepts of rehabilitation and recovery. You'll also discover how recovery addresses the whole person instead of treating only symptoms, and how this process is achieved through the 4 dimensions of recovery. When social workers treat people with mental health problems on the one hand and substance abuse issues on the other, we often speak of rehabilitation and recovery as if they were the same thing, but they are not. In addition, until recently, people recovering from mental health and substance use problems have been treated using separate approaches. In order to improve post-treatment outcomes for clients, the Substance Abuse and Mental Health Services Administration, SAMHSA, has developed a common, unified working definition of recovery that applies to both populations and to those who have both mental health and substance abuse concerns. Recovery is, according to SAMHSA, a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. Recovery is a broad term focusing on the whole person, not just a disorder, condition, or their related behaviors. Recovery has a foundation in hope, the belief that these challenges and conditions can be overcome or at least managed to promote a whole, satisfying life. People's recovery is built on their strengths, talents, coping abilities, resources, and inherent values. It is holistic, addresses the whole person and their community, and is supported by peers, friends, and family members. The process of recovery is highly personal and occurs via many pathways. It may include clinical treatment, medications, faith-based approaches, peer support, family support, self-care, and other approaches. Recovery is characterized by continual growth and improvement in one's health and wellness that may involve setbacks. And due to setbacks being a natural part of life, resiliency is a key component of recovery. Let's look more closely at what rehabilitation and recovery are and how they are different. Rehabilitation focuses more on the treatment of symptoms or the medical model approach. Rehabilitation has an underlying connotation of making things the way they were before. Recovery, as a new and different approach, gained attention as patients, clients, participants began to speak out about the experience of being mentally ill. They changed from being the passive recipients of treatment to challenging the view that mental illness is persistent and hopeless. Recovery involves the personal process of living with a mental illness or addiction disability while finding hope and a sense of self within the limitations of the illness. The medical model approach focuses on the fact that mental illness and substance abuse impact all aspects of a person's life. This approach is defined by a person's ability to function in the major domains of life: work, housing, relationships, and recreation, by managing symptoms. The person providing treatment is the expert in the field, much as a surgeon is an expert in removing tumors, and should be the main voice listened to when deciding treatment options. In essence, there is a right answer, and the treatment provider knows what it is. Recovery is a consumer-centered approach that stresses that each person's journey to recovery is unique to the person. Recovery can be a reduction in symptoms, or it could be overcoming the effects of poverty or stigma. Also known as being value-based, there's no one-size-fits-all treatment approach. Unlike evidence-based outcomes that are easily measured, value-based outcomes are more difficult to measure because they involve a person's perspectives and attitudes. Recovery challenges the medical model view that mental illness is a chronic condition and that treatment should focus solely on symptom reduction. For many, recovery means leading a fulfilling life despite having a disability and symptoms. The search for a cure is set aside in many cases to search for ways to live with the situation. Recovery happens when patients, clients, participants take an active role in change, understand their capabilities with respect to change, and use this sense of self as a resource to address stigma. Rehabilitation efforts should consist of evidence-based practices. Evidence-based practices are practices and programs with known outcomes of improvement for participants, and both their efficacy and effectiveness in their communities can be determined. Evidence-based practices demonstrate consistent scientific evidence of improvement in participant outcomes and can be assessed by the use of measurement instruments evaluating a person's participation in work, housing, relationships, and recreation. In a medical model rehabilitation setting, all of the treatment is decided upon by the expert. In the recovery approach, it is important for experts to be involved due to their technical knowledge, but the value of involving the client is overriding. The client is entitled to choose from available options even if the chosen path is not the one the expert would choose. The values of self-directed symptom management and consumer choice are most important. Rehabilitation encompasses the services and technologies available to adapt to the world. Examples include medication, therapy, psychoeducation, hospitalization, and other treatments. The client is expected to use these technologies to adapt to the world as it is. Recovery sees an importance in clients accepting their situation and making clear, conscious decisions about how to move forward. Recognizing that struggles will occur is important, but even more valuable is working with all tools available to overcome the challenges. Recovery and rehabilitation are co-occurring and are not necessarily in opposition. That is, a person may still experience major episodes of symptom exacerbation, yet have significantly restored role performance through the use of available supports and removed significant opportunity barriers. From a recovery perspective, those successful outcomes may have led to the growth of new meaning and purpose in the person's life. This can reoccur throughout a person's recovery process. When rehabilitation is used with a client-centered recovery approach, we believe a large step forward has been taken. Rehabilitation programs in relation to mental illness and substance abuse do not involve all aspects of people's lives, and they do not reflect a patient's humanity. Recovery incorporates a person's humanity into their treatment plan. As part of describing recovery, SAMHSA delineated 4 major dimensions that support a life in recovery. Health. Overcoming or managing one's disease or symptoms and making informed, healthy choices that support physical and emotional well-being. For example, abstaining from the use of alcohol, illicit drugs, or non-prescribed medications if one has an addiction problem. Home. Having a stable and safe place to live. Community. Having relationships and social networks that provide support, friendship, love, and hope. Purpose. Conducting meaningful daily activities such as a job, school volunteerism, family caretaking, or creative endeavors, and the independence, income, and resources to participate in society. In order for full recovery to occur, treatment must successfully address all 4 dimensions. To summarize what we have covered in this video, you have learned that recovery goes beyond the medical model of treating only a person's symptoms and addresses the person holistically. To support a person's recovery, 4 areas must be addressed: home, health, community, and purpose. In the next video, you'll learn what SAMHSA's 10 guiding principles of recovery are and how to apply them to the areas of mental health and substance abuse.